And for those hoping to see the pandemic end in 2021, well, it did not happen. But in the practice of making a resolution for the new year, Christina Laurie talked with Dr. Jeff Pothof of UW Health about his wishes for COVID in 2022 and whether or not he thinks it will come true.
If you are over talking, hearing, worrying about COVID,
there is just only so much that human beings can take before they say, you know what, like I just can't do this anymore.
UW Health Dr. Jeff Pothof is with you.
You see death and dying, so many days in a row. It just starts to wear on you.
Only he has spent more than 600 days fighting it firsthand.
You see kind of the sorrow that it causes, not only for the person that's affected. Oftentimes, they're in a coma. It's the family members that come in.
And he's exhausted.
This is preventable.
The pandemic isn't going the way Pothof or any of the country's top doctors predicted. The Omicron variant is setting new records every single day. And the most frustrating part,
it didn't have to be this way. I think what made it worse is we all felt it was almost an emotional moment when vaccines became available, thinking this is it. We made it. All we got to do now is get vaccinated and this goes away.
4 of 5 people in Dane County are fully vaccinated, but statewide the vaccination rate is at 3 in 5, making it likely you know several who haven't gotten their shots.
My wish for 2022 would be easy. I would wish everyone would have a sudden change of heart. And we'd have very high vaccination rates in this country. We'd have very high rates of boosters.
One of the best ways to do that is encourage and remind your family and friends to get and stay protected.
And what we would see is likely COVID continuing, but we would see mild cases, folks who don't get very sick. They won't necessarily need to require a hospital.
Making a resolution that'll help us all this new year. In Madison, Christina Laurie, News 3 Now.
You can still schedule an appointment for a COVID vaccine or booster shot online anytime. We have links to do that on our website.